If your lower back locks up after just 10 minutes of walking, the problem likely isn't your spine, it's your hips. In this video, we're going to release the brake pedal that is compressing your vertebrae with every step you take. We are going to cover the psoas paradox, why sitting weakens your walking muscles. Then, I'll guide you through a simple 3-step structural test to confirm if this is your issue, followed by 2 mobility drills you can do right now to double your walking distance without pain. We are talking about the psoas muscle, pronounced psoas tis. If you have lower backache specifically when you are upright and moving, this muscle is the prime suspect. It is rarely the fault of the lumbar discs themselves. Think of the psoas as the invisible bridge connecting your torso and your legs. It is the only muscle that attaches high up on the side of the lumbar spine, crosses the hip joint, and connects down to the thigh bone. It is critical for lifting your knee and stabilizing your core. Here is the psoas paradox. Most men over 60 spend a significant portion of their days sitting, driving, watching television, working at a desk. When you sit, this psoas muscle stays in a permanently shortened position. It is dormant, but it is not relaxed. Over years, it loses its ability to lengthen fully. It becomes chronically tight. This tightness creates a very specific problem when you finally stand up and try to walk. The tight psoas pulls your entire pelvis forward and down at the front. This motion is called anterior pelvic tilt. Imagine your spine is an accordion. When your pelvis tilts forward, the accordion compresses the lower back segments L4 and L5. This forces your back into an excessive arch, what some call swayback. This unnatural curve significantly narrows the space where nerves exit the spine, causing compression and that characteristic dull, aching pain that begins precisely when you start walking. If you are experiencing this, understand this is a mechanical failure, not a moral failure. Your psoas muscle is simply stuck in the sitting position. The compression worsens with every step you take until you are forced to stop and rest, often leaning forward on something for relief. If you are serious about taking control of your health and mastering your mobility, subscribe to Gentleman's Vitality now. We cut through the confusion to give you science-backed strategies every single week. To solve this, we must first confirm that the psoas is indeed the problem. Stop guessing. Start testing. We need a simple, reliable structural test that you can perform safely at home. This test is a modified version of the standard Thomas test, which assesses hip flexor tightness. You need a firm surface, preferably the edge of a bed or a sturdy table, about knee height. Sit right on the very edge, so your mid-thighs are fully supported, but your knees are hanging freely off the edge. Step 1 of the test. Lie back slowly onto the bed or table. Do this carefully, using your elbows to lower yourself down. Once you are flat, pull one knee. Let's start with the right knee, up toward your chest, and hold it firmly with both hands. This action is crucial. You are using your arms to stabilize the lower back completely. This stabilizes the right side of the pelvis. Step 2. Observe the opposite leg, the left leg that is hanging off the edge. What does that leg do? If your psoas is healthy and lengthened, the back of your left thigh should drop down easily, completely flat against the bed. The angle of the knee should hang at roughly 90 degrees, or even slightly lower than the hip. Step 3. Look for the telltale sign. If your left hip flexor is tight, the back of your thigh will not touch the bed. It will pop up, leaving a gap. Worse, if the tightness is severe, the knee angle will actually straighten out, trying to lift the foot back toward the floor. If you see that gap under the thigh, or if your knee straightens when you pull the other leg to your chest, you have just confirmed the source of your walking pain. The tighter side is the side that requires immediate attention. Remember which side failed the test. You may find that one side is much tighter than the other. This asymmetry is common and contributes to uneven gait, making the problem worse over time. If both sides failed, then you need to commit to the relief plan we will detail next. This test confirms the anatomical reality that your back pain is simply a symptom of hip muscle restriction. Now that we have identified the brake pedal, we must release it. Our relief plan focuses on a two-part approach: stretching the chronically tight psoas and then immediately activating its opposing muscle, the gluteus maximus. You cannot stretch a tight muscle effectively without reminding its opponent to take over. This is called reciprocal inhibition, and it is key to long-term relief. Let us start with the psoas release drill. This is the standing wall lunge stretch, Lurie stretch. This variation is safer and offers better balance for men 60+ than floor-based lunges. Stand about 2 to 3 feet away from a sturdy wall or the back of a solid chair. Place your hands on the wall for balance. Step one leg forward. Let's start with the tighter side, say the left leg. The right leg will be trailing behind you, with the toes down. The critical difference between a good stretch and a painful back arch is the position of your pelvis. You must perform a slight posterior pelvic tilt. Think about tucking your tailbone underneath you. Imagine pulling your belly button slightly toward your spine. This action flattens your lower back and keeps the stretch focused entirely on the front of the hip. Slowly bend your front knee, dropping your hips slightly toward the floor. You should feel a stretch, not a strain, deep in the front of the hip joint on the trailing leg. Hold this position for a full 60 seconds. Do not bounce. Bouncing activates the stretch reflex, causing the muscle to tighten up even more. We want deep, static lengthening. During this minute, focus on deep, slow breathing. Breathing helps the nervous system release the tension. If you feel any sharp pain in your knee, shorten your stance or use a slight pad under the back knee. This stretch is about creating length in the muscle responsible for your walking pain. Once you finish, slowly come out of the stretch and switch sides. If one side was significantly tighter, you should perform that side one additional time. Consistency is key here. This stretch needs to be performed daily, preferably just before your intended walk. This prepares the muscle for movement and tells your nervous system that it is safe to walk without excessive compression. Now for the second critical step, Namateas the glute bridge wake up. Namateas the gluteus maximus is the largest, most powerful muscle in your body. It is supposed to power your walks and stabilize your pelvis. When the psoas is tight, the glutes often become weak and unresponsive, that gluteal amnesia we talked about. We need to wake them up. Lie down on your back, comfortably on the floor or a firm mat. Bend your knees and place your feet flat on the floor, about hip-width apart. Your heels should be close enough that you can lightly brush them with your fingertips. Your arms rest straight down by your sides. The movement must come from the rear, not the back. Before you lift, gently flatten your lower back into the floor. This activates your core stabilizers. Now, push your feet into the floor and consciously squeeze your glutes. Drive your hips upward until your body forms a straight line from your shoulders to your knees. Crucially, do not push so high that you feel the squeeze in your lower back. If you feel your lower back arching or cramping, you have gone too high. Lower slightly. The entire effort must be concentrated in the buttocks. Hold the top position for a count of 5 seconds. This isometric contraction is highly effective for retraining the muscle to fire. Slowly lower your hips back down. We are going to perform 3 sets of 10 repetitions, focusing on that deep, deliberate squeeze at the top of every representative. You are establishing a neural connection, reminding your brain that the glutes are supposed to be active. These 2 drills, the psoas stretch and the glute bridge, form the core of your pre-walk relief plan. If you consistently commit just 7 minutes to this routine before you start walking, you are structurally setting your body up for success. You are ensuring that your pelvis is in a neutral position, meaning your spine is decompressed, and the shock absorption is handled by your muscles, not your discs. Let us address common obstacles and refine the execution for men 60+. We know balance can be a concern, which is why we emphasize the wall or chair for the lunge. We also understand that getting down on the floor for the bridge may be difficult. If getting on the floor is a barrier, you can substitute the glute bridge with asterisk standing mini squats, asterisk or asterisk standing hip extensions. For the standing hip extensions, stand facing a sturdy countertop for support. Lift one leg straight back just a few inches, squeezing the glute on that side. The key is to keep your torso absolutely upright. Do not lean forward. This slight backward lift, performed for 15 slow repetitions per side, achieves the same goal, activating the sleeping glutes. The goal is to make this plan sustainable, adapting it to your current mobility level. Do not let minor restrictions stop you from making major gains. What about the walking itself? How do you maintain this newly found alignment? You need to adjust your gait slightly. Many men with psoas tightness tend to overstride. They take steps that are too long, reaching out with the foot. This reaching causes the leg to land too far ahead of the body, which forces the pelvis into that problematic anterior tilt earlier in the walking cycle. Instead, focus on a slightly shorter stride and a slightly quicker cadence. Think about taking more steps per minute. Shorter steps keep your foot landing closer beneath your center of gravity, naturally promoting a neutral pelvis and minimizing the shock wave that travels up to your lower back. Another helpful cue is to slightly squeeze your rear end with every step. This keeps the glutes engaged throughout the entire walk, acting as a muscular corset to stabilize your lumbar spine against compression. Many men confuse low back pain from walking with serious disc pathology. While we always advocate consulting your physician for a full diagnosis, understand that biomechanical issues like the tight psoas are often the primary driver of discomfort after repetitive activities like walking. Stretching and strengthening these key areas is a powerful, non-invasive intervention that research has consistently linked to improved function and reduced pain severity in older adults. You are not treating an illness, you are restoring function. Think about the long-term benefit. Walking is the single best activity for cardiovascular health and longevity. It is often the first activity restricted by chronic pain. By fixing this mechanical flaw, you are not just getting 10 minutes of relief, you are reclaiming your health independence. You are extending the time you can spend active, whether that is walking the golf course or keeping up with your grandchildren. This level of consistent activity directly boosts your energy and mental vitality. It is a fundamental tool for mastering your health as you age. Do not treat the symptom, treat the structural cause. Start today by adding the standing wall lunge and the glute bridge to your morning routine. This small investment of time yields massive returns in pain-free walking distance. Your back may hurt, but your hips hold the key. If this video has clarified the source of your walking pain, please take a moment to like the video. It helps us reach more men who are struggling with mobility and are looking for evidence-based solutions. If you want more expert back strategies to improve your mobility and boost your vitality, subscribe to Gentleman's Vitality now. We are committed to helping you live a stronger, healthier, and more vibrant life. Take control of your health today.